As more West Virginians are diagnosed with cancer, physicians have more treatment options, including a new type of cancer treatment called targeted therapy. Joining me to discuss about that and other advancements is Dr. Stephen Jubelirer, who specializes in hematology and oncology at Charleston Area Medical Center. Welcome to the program, Dr. Jubelirer.
Thank you very much.
Well, let's get started. Let's talk about what is the state of cancer in West Virginia?
Well, in West Virginia, as I think you've well enumerated it at the beginning of the show, the West Virginia Cancer Plan from the Mountains of Hope is, I think, a very laudable thing, and I think it's outstanding. Cancer is a big problem in West Virginia. There's, as you probably know, there's a little over 11,000 cases of cancer in West Virginia, about half of whom the deaths are about 4,000. The cancers that we see most frequently are the ones that one would expect, include lung cancer, colon cancer, breast cancer, and prostate cancer. And they make up about 50% of the cancers that we see here in West Virginia. But if you look at the mortality, the death rate from cancer, I think lung cancer, if you take it both men and women together, I think lung cancer is still the most common cancer that causes death.
Absolutely. So we've got some cancers that are common. We've got other that are may be common but also are more deadly, like lung cancer. Right. Obviously, we talked about immunizations a little bit ago. What about screening for cancer? What are the most common screening avenues, and should people get those done?
Well, certainly mammography is crucial.
Okay. For breast cancer?
For breast cancer, certainly.
Yeah.
Colonoscopy or stool for occult blood is very important for certainly colon cancer. I think those are absolutely crucial. The role of PSA in prostate cancer is an area of controversy, and I think that most of the organizations now don't automatically advocate PSA testing, but I think if someone wants PSA testing, the physicians are told to give them the pros and the cons, and then the patients themselves can make their own mind.
Would it be the same thing for lung cancer? Because now Medicare reimburses for a CT scan for lung cancer. Is that something? What would be the recommendation there?
Well, I think the recommendations for lung cancer screening are those people who are at high risk for getting lung cancer. And those are people who are heavy smokers, 30-pack years, usually between the ages of 55, and now they've extended it to 80. So those are the people in the original trials were the ones that were most eligible.
Absolutely. Now, when we talk about screening, we also talk about medications, because a lot of people often ask, hey, are there any medications that would prevent cancer? Meaning that what can you take on a daily basis? Obviously, there's a lot of misinformation out there, including the role of vitamins and other medications, so including herbal products. So talk to us about what does science say?
Well, in terms of cancer, the only real drugs that have been advocated and shown in clinical trials to actually decrease the risk of cancer is breast cancer. People are at high risk, those with a family history of breast cancer, those who have a genetic predisposition such as the BRCA1 and 2 genes, for example, those that have had a strong family history, or those who have had certain precancerous lesions are the ones that might benefit from certain hormonal therapy. There's the breast cancer prevention trial, which indicated that tamoxifen, which is a drug that we used for preventive cancer in patients who've had primary cancer, for 5 years has been shown to decrease the risk of recurrence or getting breast cancer in those people. In older individuals, a drug called Arimidex, which is used in postmenopausal women. So for breast cancer, we have clinical trials.
So certainly not the common vitamins, certainly no herbal product that we know of.
No.
How about aspirin?
Well, aspirin is an interesting drug. There is a lot of retrospective data that has indicated that patients who take aspirin may have a decreased incidence of certain cancers, particularly colorectal cancer. The problem is that most all of the studies have been large retrospective studies. The only randomized study that we know of for aspirin is a group of individuals who are at high risk for colon cancer that have what we call Lynch syndrome, and there a high-dose aspirin was effective. So aspirin has been touted, at least by some experts, to prevent colon cancer, particularly for those who have a predisposition to it or are at high risk of getting it.
And retrospective studies are those that we actually go back and analyze the data, and of course they have value, but not as much value as we go forward and analyze the population.
Yeah, most of the studies with aspirin are basically retrospective studies looking at preventive aspirin and to prevent coronary disease.
Exactly, heart disease.
Yes.
And let's talk about, since we're talking prevention, let's also talk about advances in therapy for cancer. What are really the real medical advances that have happened, and are West Virginians able to take advantage of those advances?
Well, I think the most dramatic advance in therapy is what we call targeted therapy. Now, people ask, well, what do you mean by targeted therapy? Well, basically, targeted therapy is basically medications that target not the entire cancer cell, but basically target a specific abnormality in the cancer cell, a specific molecular abnormality. Examples, for example, in breast cancer, we have what we call hormone receptors. And those women who are positive for hormone receptors, if they are positive for those, then certainly certain hormone therapies like tamoxifen or Arimidex can be used to delay the progression of cancer and significant improvement in quality of life. The other, I mean, most of the cancers that we see now have targeted therapies for them.
Would you consider that this targeted therapy, as you very well explained, could be called either a game changer or a revolutionary change in the way we treat, and we will be treating cancer going forward?
I think it is revolutionary. Actually, it has been ongoing probably for the last 5 to 10 years. But I think that for every cancer that we see, there's now molecular abnormalities that are targeted that are, in some ways, because they're targeted, you don't have the side effects necessarily that you do with systemic chemotherapy, for example.
So you're not going to be losing your hair and having infections and all kinds of things. Tell me, if a West Virginian across the state is suffering from a particular cancer and wants to know more about if that's available, targeted therapy, where should they go to? What help should they seek?
Well, certainly every hospital has their cancer center, cancer information center, so certainly basically calling the cancer centers around the state will certainly be very, very helpful. Maybe looking on the National Cancer Institute website for cancer therapies. They'll give you all the information you need about various targeted therapies, clinical trials that are available.
And often I talk about this because a lot of times there are very advanced clinical trials ongoing that often cost nothing to the person themselves, that people can be enrolled into at one of these advanced cancer centers and be at the cutting edge of therapy.
Yes, absolutely.
Yeah, so National Cancer Institute, certainly reach out to your regional cancer center at local hospital or regional hospital.
Every major cancer center in West Virginia, every major hospital has an oncology program, and all of the doctors there participate in clinical trials.
So we've talked about that. I also want to talk in the last few minutes that we have remaining about palliative care. I think it's very important that with all of these advances, both in prevention and treatment, including surgical and radiation therapy that we haven't been able to get to yet, but at some point we can discuss those. There are those individuals who will reach the end of the road or get close to it. What is palliative care?
Well, palliative care, and this is a question that I get asked about frequently. Palliative care basically is care looking at treating the symptoms of cancer, not necessarily the actual cancer itself, but treating the symptoms of cancer, nausea, vomiting, pain, constipation. But it's not only treating the symptoms, but also the psychology of the patient, family relationships. So you really cover the whole gamut, the symptoms, the psyche of the patient, the anxiety of the families, trying to address all of these things. But I want to emphasize that palliative care is not just for end of life, although it's certainly important. But I think more and more treatments, even people with advanced cancer who are undergoing definitive therapy, the emphasis is to get palliative care early because they have found improved survival in those patients.
So you get into palliative care while you're getting treatment, and then let's say some will be end of life, but others will survive and do well. So let's talk about cancer survivorship, because more and more people are able to survive their cancer now and live longer. What are the issues related to cancer survivorship?
The main issues of survivorship are several. Number one is the side effects of therapy. You know, the heart disease that you get long-term from some of the drugs that we use. And of course, you know, we have cardiologists who have special interest in that. Some people have neuropathy or numbness in their fingers and toes for some of the chemotherapy. Some of the anxiety and the depression is long-term issues. Employment may be a bit significant for some patients, so that's an issue. Second cancers. Many people get second cancers down the road, 5 years, 10 years. So there's also screening for second cancers, which we do frequently. And those are the major issues.
So as people are living, obviously surviving cancer, living longer time, there becomes issues, as we see with a number of other chronic diseases that you're able to survive, which are very much, as you mentioned, high cholesterol, diabetes, heart disease, stroke, some of the things you would expect anyway as part of aging, as well as others like cancers, other cancers. Very much we're getting to the close. I want to get your views. If you were able to see through a window in the next 5 to 10 years in cancer advancements and therapy, what would you be able to tell West Virginians is on the horizon, and how well do you believe we're going to be able to do in West Virginia with regards to cancer, both prevention, treatment, as well as survivorship?
Well, I think we're going to have more vaccines to various cancers. I would say in 5 or 10 years, I think chemotherapy, as we know, will be eliminated, hopefully, and everything will be targeted and much easier for the patient.
Great. Well, I want to thank you for being here today. Thank you, Dr. Jubelirer.
My pleasure.
And that's all the time we have for today's show. Thank you for watching The State of Health here on the Library Television Network. Remember, you can always follow us on our DHHR Facebook, Twitter, and website. I'm Dr. Rahul Gupta, State Health Officer and Commissioner of the West Virginia Bureau for Public Health. On behalf of Secretary Bowling, thank you for watching.